Efforts are underway at the Kingston Public Hospital to get surgeries back on schedule following a period of disruption. The hospital says repairs have been completed on its operating theaters. Details in this report. One of the theaters was out of service for some time due to a malfunction. The necessary parts had to be sourced from overseas. Chief Executive Officer at the Kingston Public Hospital, Dwayne Francis, says the parts have since arrived and the theater has been repaired.
We would have received the HEPA filters for the main operating theater, and the OPD South theaters are now operational. So in total, we have 6 operating theaters functional at this time. We continue to monitor the system and to ensure that these units remain operational despite their age. There is plans afoot also to replace those central units because of their age and to ensure for continuity and reduction in downtime of the theater units because of air conditioning unit challenges. So we are now moving to the second phase of planning for the replacement of the unit.
Mr. Francis says the hospital is now trying to clear a backlog of surgeries.
So some of the patients who were affected with our theaters being down were those patients who are elective cases. An elective case patient is a patient who is, their surgery is important, but it is not critical. And as such, they would have gotten booked appointments for the cases to be done. The institution, however, understands the impact it has on the patient and also their family. And we ask for their understanding while we continue to improve on our service and get back to normal operation.
He says the hospital is working to return to normal surgical operations. However, an elevator issue remains a challenge.
Yes, they are. So our elevators are working. We would have gotten up 2 of the 3 elevators that were down on the main surgical block. The third one, the contractor is awaiting delivery of parts to have that one up. And once that part comes, the elevator will be up. So out of 4 elevators on the main administrative block, 3 will be operational in short, and 1 is for total replacement. And that is currently something we're working on having done.
Overcrowding at the accident and emergency department is also a concern. Mr. Francis is urging patients who do not require emergency care to seek treatment at the primary care level, including clinics.